Welcome to Navigating COPD, a physiotherapist perspective. Today we will explore how physiotherapy can transform the lives of people living with COPD.
Chronic obstructive pulmonary disease affects over 300 million people globally and is the third leading cause of death worldwide. But here is many don't realize while COPD cannot be cured, physiotherapy interventions can dramatically improve quality of life, reduce hospitalization, and help patients breathe easier.
Whether you are a healthcare professional or a COPD patient or caring for someone with this condition, this video will provide you with valuable insights backed by current research which you can implement immediately. To effectively treat COPD, we must first understand what's happening in the lungs. COPD is characterized by persistent airflow limitation due to airway and alveolar abnormalities, usually caused by significant exposure to noxious particles or gases. The pathophysiology involves three key mechanisms: chronic inflammation, protease antiprotease imbalance, and oxidative stress. This leads to airway remodeling, mucus hypersecretion, and destruction of lung parenchyma. COPD severity is classified using the GOLD system into four stages, but numbers only tell part of the story. Patients experience progressive dyspnea, chronic cough, sputum production, and decreased exercise tolerance. These symptoms create a vicious cycle. Activity avoidance leads to deconditioning, which worsens breathlessness, leading to further inactivity. Additionally, COPD rarely exists in isolation. Common comorbidities include cardiovascular disease, osteoporosis, diabetes, depression, and anxiety. Effective COPD management begins with comprehensive assessment. As physiotherapists, we are detectives gathering clues to build the complete picture of how COPD affects each individual patient. Physical examination reveals crucial insights. We observe breathing patterns, use of accessory muscles, chest wall deformities, and digital clubbing. Auscultation helps identify wheeze, crackles, or reduced breath sounds. We assess posture as many COPD patients develop forward head posture and kyphosis to optimize breathing mechanics. Spirometry provides objective lung function data, while pulse oximetry and arterial blood gases reveal oxygenation status. Don't forget to assess peripheral muscle strength. Quadriceps weakness is common and correlates with reduced exercise capacity and increased mortality risk. Finally, we evaluate functional capacity through activities of daily living assessments. How does breathlessness affect dressing, bathing, or climbing stairs? This information guides our treatment priorities and helps set realistic patient centered goals. Physiotherapy for COPD encompasses four main areas: breathing retraining, airway clearance, exercise training, and patient education. Let's start with the breathing techniques. First, lip breathing is fundamental. It helps reduce respiratory rate, decrease work of breathing, and improve ventilation perfusion matching. Teach patients to inhale through the nose and then exhale through the pursed lips. Diaphragmatic breathing retrains the primary muscle of respiration. Many COPD patients rely heavily on accessory muscles, leading to inefficient breathing patterns. Place one hand on the chest, one on the abdomen. The goal is minimal chest movement with gentle abdominal rise during inspiration. Coordinated breathing integrates these techniques with daily activities. For example, when climbing stairs, inhale before the step, exhale during the effort. This prevents breath holding and Valsalva maneuvers that can worsen dyspnea. For patients with excessive sputum production, airway clearance techniques are essential. Active cycle of breathing technique ACBT has three phases. First, breathing control. gentle diaphragmatic breathing for relaxation. Second, thoracic expansion exercises, deep breathing with 3 seconds inspiratory hold to get air behind secretions. Third, the forced expiration technique or huffing, forced exhalation with open glottis to mobilize secretions. Positive expiratory pressure devices, PEP, can enhance secretion clearance. These handheld devices create back pressure during expiration, helping to open airways and mobilize mucus. Oscillatory PEP devices add vibrations that further assist secretion loosening. Exercise training is the cornerstone of pulmonary rehabilitation and the most evidence based intervention for COPD. A comprehensive program includes both aerobic and resistance training. Aerobic training should target 60 to 80% of peak heart rate or 40 to 60% of peak work rate for 20 to 30 minutes, 3 to 5 times per week. Both continuous and interval training are effective. Interval training may be better tolerated in severe COPD patients. Resistance training addresses peripheral muscle dysfunction common in COPD. Target major muscle groups with 2 to 4 sets of 6 to 12 repetition at 50 to 85% of one repetition maximum. Evidence shows significant improvement in muscle strength, exercise capacity, and quality of life. The key is progressive overload and consistency. Education empowers patients to manage their condition effectively. Key topics include disease understanding, medication management, inhaler technique, energy conservation strategies, and action plan for exacerbations. Proper inhaler technique is crucial. Studies show up to 50% of patients use inhaler incorrectly, reducing medication effectiveness. Regular assessment and correction of the technique should be part of every consultation. Real world COPD management involves complex patients with multiple comorbidities. Let's explore special consideration and advanced techniques. Cardiovascular disease is present in 50 to 60% of COPD patients. Exercise programs must be carefully prescribed, considering cardiac limitations while still challenging respiratory capacity. Beta blockers, once contraindicated, are now recognized as potentially beneficial and safe in stable COPD. Osteoporosis affects up to 70% of COPD patients, particularly those on corticosteroids. Weight bearing exercises and resistance training help maintain bone density while improving respiratory function. Depression and anxiety are common but under recognized. Physiotherapy interventions, particularly exercise training, have significant psychological benefits beyond respiratory improvement. For severe COPD patients, advanced techniques may be necessary. Non invasive ventilation during exercise can enable higher training intensities. Neuromuscular electrical stimulation can benefit patients too severe to participate in conventional exercise. Aquatic therapy offers unique benefits. Hydrostatic pressure supports ventilation, while water resistance provides gentle strengthening. The warm, humid environment can be particularly beneficial for COPD patients. Technology integration is expanding treatment options. Smartphone apps for symptom monitoring, wearable devices for activity tracking, and telehealth platforms enable remote monitoring and support. Knowledge without implementation has limited value. Not all patients can access formal pulmonary rehabilitation. Home based programs can be equally effective with proper instruction and support. Simple equipment like resistance bands, small weights, and a step can create comprehensive exercise program. Digital health tools are revolutionizing home based care. Apps providing exercise guidance, symptom tracking, and educational content can supplement traditional physiotherapy. Emerging areas include precision medicine approaches, biomarker guided therapy, and novel exercise modalities like whole body vibration and virtual reality enhanced training. The COVID 19 pandemic accelerated adoption of telehealth, opening new possibilities for remote physiotherapy delivery and monitoring. COPD is a complex, progressive disease, but physiotherapy offers hope. Through comprehensive assessment, evidence based interventions, and patient centered care, we can help people with COPD breathe easier, move better, and live fuller lives. If this video helped you to understand COPD physiotherapy better, please like and subscribe for more evidence based healthcare content. Share your experiences in the comments. What techniques have you found most helpful?